Hi all. ISO CanCon is have an eminent personality, Dr. Mothi Babu Ramalingam. He's from Singapore Government Hospital. So we can have a talk with him. Sir, very good morning. What is your experience to be here in our ISO CanCon? It's the fifth CanCon.
Good morning. I think so far it's been wonderful. I think there's so many different types of talks and there's interesting pre-conference workshop. I think cancer is a very complex disease and is becoming more common and there's a lot of new treatments coming on. And having such workshops and conferences really expose different doctors and nurses and different members of the healthcare team to recent advances. I've thoroughly enjoyed the entire workshop and the conference so far. Um, I am very much interested in to know how MVR is trying their best to push ahead in the cancer care into the future. Yeah, thank you very much.
So you are specialized in rehabilitation of in part of physical medicine. So what is the role of physical medicine in onco care rehabilitation?
Physical medicine and rehabilitation in cancer patients. I think cancer patients go through various stages of in care in general. So they are either at the term of diagnosis, or they are just started treatment, or they are at the end where they're going to finish treatment and become a cancer-free survivor. So physical medicine and rehab is like a supporting arm which travels the entire journey, whether they are in surgical treatment or whether they are getting chemotherapy and radiotherapy. Rehabilitation is just one phase where when patients have not started any form of treatment, we try to provide care in such a way to improve their physical and mental resilience. For example, nutrition. So we try to focus on their nutrition and making sure they are nutritionally fit so that they can tolerate whatever treatment they're going to receive. The second part is about physical fitness. So I think exercise in cancer is something which is very close to my heart and is also something which patients have to be motivated to do. So in general, prehab is a part of rehab in cancer. It is mainly targeted once you get diagnosed and you have not started treatment, and it's to make sure that you finish your treatment and improve treatment tolerance. Yeah.
In the post management of oncological patients, there are survivors. They have a doubt that is if we can do which type of exercise is good for us. Can we do the exercise as part of treatment? They will be have complete rest for their still of their life. What is the role of physiotherapy in that part of exercise?
Excellent question. I think exercise is like the foundation for cancer rehab. It's not about whether you have cancer or you don't have cancer. I think exercise is important because you can prevent cancer. But once patients have finished treatment, I think that the general thought process is that everybody wants to rest. So they think that by resting they will recover. Or the family members will say, "Oh, you just finished treatment. Why don't you rest?" So exercise, whether it is delivered by physiotherapy or directly physiotherapy, I would say is the backbone of cancer rehab. And with regards to exercise, there are a few principles. Number one is always speak to the doctors to see whether you're fit to exercise. Number one. Number two, start slow, go slow. And that is the second principle. So if you have never exercised, we always tell the patient to start slow and then go up. And we have different types of exercise based on where you live, what you can afford to. So we modify and it is tailor-made to the patient. So I think exercise is a must and it's a need for all cancer patients. And it is, if the oncologists tell the patients that you should go and exercise, they would definitely believe that it is going to help their care. So I feel that that's the important awareness we are working towards.
The patient's follow-up in physical medicine is a many issue happen to the patients itself. They are coming to visit the physiotherapy or physical medicine department once a time and the follow-up is not happening. What is the importance of follow-up in physical medicine in for the patients?
Yeah, again, a great question. I think once patient starts, for example, patient starts a specific treatment, they are already bothered by there's a concept of financial toxicity or money being involved. So every treatment is challenging. So with regards to our follow-up, when we know that the patient has certain problem, like we call it impairment, or in certain words we call like distress in the patient, we definitely have to follow up until the distress level is lower that the patient can manage themselves. So classic physiotherapy sessions are more intense in the first few months, maybe once a week we see them, and then move on to once in a month, once in 3 months. But from the doctor side, we review patients between 3 to 6 months. But again, it depends on the type of problem. So those patients who have completed treatment, we let them take health into their hands. I think it's not about um, health and treatment now. I think it's about health and wellness. So after treatment, patients are followed up a bit more, less frequent, I would say, between 6 to 12 months.
What is the possibility of researches happening in physical medicine as a part of oncological care?
Um, I think research is something which pours petrol to your clinical service. So if your clinical service is a car and it's already running on some petrol, you want to push the car ahead, I think you should do research. And in regards to rehab and research in cancer care, I think that it's only in the last 10 years we are seeing more publications coming out. A lot of work is being still handled for, they get divided between surgical patients who are receiving cancer care or chemo and radiation patients. But now the research is being focused on survivorship, in overall cancer survivorship. So physical medicine is being rehab and physical medicine is being embedded into survivorship phase. So we do a lot of research in community-based care. So we want to keep patients out of hospital. So we do research how to keep them at home, keeping them active at home and healthy at home. We are also doing a lot of research on obesity prevention in cancer patients because it's a very big problem as well. So research can be differentiated into whether you are focusing on controlling the problems because of the treatment, or you are making them living longer by better quality of life. So this is our usual research focus.
So, what is the possibility of researches in physical medicine as regarding to the onco care units?
Yeah, I was I used the term research fuel service. So if you think about your clinical service as a car which you just started, you want to keep the car going, you need to use research as a fuel. And you can do research in different phases of cancer care. We are a lot dependent on proving patients' health and wellness and keeping them out of hospital, that kind of a research. We call it as population health research. We are also doing research to see whether we can shorten length of stay, rehabilitation research, and also delivering exercise at home, those kind of research. We have mainly been using breast and gynecological cancer for our research. The basic reason is huge volume. So you should choose where is the necessity at hospital level, community level, maybe even at government level, which cancer you want to tackle, and then you plan the research. Within physical medicine and rehab, there's very big role for research because we still haven't proven that it is part and parcel of cancer care. So I think it's definitely important to do. Yeah.
Okay, then comes our last question. Diagnosing a cancer, it is the journey of a patient from diagnosis to the survivorship. As part of a physical medicine rehabilitation head, can you have a information to our public that what is the role of physical medicine in your journey in cancer care?
I think um, if you want to walk your entire journey well and long enough, you probably have to hold two hands. I think one hand is your oncology care providers, whether they are surgical oncology, medical oncology. Other hand, you have to give it to this team, which I won't restrict to the doctors from the physical medicine and rehab. It's about your physiotherapy, your dietitian or nutrition team, other therapists, speech therapists. So this journey, we always want to walk with you. The importance is on the day of diagnosis. When you get diagnosed, of course, you are overwhelmed by a lot of things. But once you have decided in your mindset, always speak to the oncologist to see how else they can help you besides just giving medications and treatment. So always talk to your healthcare professional and see if we can incorporate physiotherapy or exercise into your treatment program. I think that's the way to start, and I think the people would change eventually.
Okay, thank you. As a part of a on-hand runner along with the oncology team, you have a good career and a future and a bright life. And I think we are enjoying our ISO CanCon for the rest of the days. Thank you.
Thank you very much.